The nocebo effect is a psychological phenomenon where a patient's pessimistic belief about a treatment results in a more detrimental outcome than what would have been realized otherwise. This concept demonstrates that an individual can experience adverse side effects they anticipated, even if the treatment is harmless. It's a phenomenon that arises from the person's own negative mindset, not from the treatment or medication itself. This idea feeds into the larger psychological concept of the placebo effect, where a patient's optimistic expectation leads to improved results. One can observe the nocebo effect in situations where a person gets sick due to the mistaken belief of being exposed to harmful substances, like supposed contaminants in a SARS-CoV-2 vaccine or harmful physical elements such as electromagnetic radiation. Both placebo and nocebo effects are thought to originate from psychological factors, yet they're capable of triggering noticeable physical changes. A comprehensive review of 31 individual studies revealed that nocebo effects could induce a spectrum of symptoms from physical discomforts, such as nausea and stomach pain, to emotional disorders like depression and sleep disturbances. The term nocebo was created by Walter Kennedy in 1961 and comes from the Latin nocebo, meaning I shall harm. Kennedy introduced this concept as a contrasting idea to placebo, a substance that can produce a beneficial, healthful, or desirable effect thanks to the power of positive thinking. It's important to highlight that, according to Kennedy, the nocebo effect represents an individual's response, grounded in the patient's own belief system rather than in the medication. Interestingly, this psychological response can manifest as physical symptoms. For example, anticipated pain can trigger anxiety, causing the release of cholecystokinin, a compound that enhances pain perception. In its strictest interpretation, a nocebo response is seen when a subject participating in a drug trial experiences exacerbated symptoms following the administration of a harmless placebo treatment. Modern pharmacology understands that a placebo, being chemically inert, could not scientifically cause any deterioration in a patient's symptoms. Consequently, any observed decline must be attributable to a subjective factor, such as adverse expectations nullifying the pain, relieving effects of anesthetic drugs despite being triggered by the placebo. The worsening symptoms are not chemically induced by the administered substance. Studies have demonstrated that a person's hypnotic susceptibility does not directly impact their manifestation of placebo or nocebo effects. Based on Goley's biosemiotic model from 2022, the expectations of harm or healing can develop into a multimodal image, provoking temporary homeostatic or allostatic interoceptive emotions. Such repeated experiences may lead to epigenetic alterations and create new bodily responses like placebos and nocebos. Research has exposed that highlighting potential side effects to patients can trigger those effects due to the nocebo effect, regardless of whether the medication is genuine. Clinical trials have seen this phenomenon where a proportion of patients stopped participation due to adverse reactions attributed to the nocebo effect. For instance, an 80 dropout rate was observed in a meta-analysis of 41 clinical trials for Parkinson's disease treatments. A significant number of patients also reported intervention-related adverse reactions while taking placebo in these clinical trials. A review in 2022 concluded that 72 of adverse effects following the first COVID-19 vaccine dose and 52 following the second dose were attributable to the nocebo responses. Multiple studies pointed out that improper health education, media, and other sources inducing health anxieties and negative expectations could influence the formation of nocebo responses. Evidence also suggests that symptoms of electromagnetic hypersensitivity stem from the nocebo effect. Stewart, Williams, and Pod challenged the usefulness of differentiating between placebo and nocebo in the context of inert agents, stimulating positive versus negative outcomes. They highlighted that the same agents could produce both positive and negative effects. The categorization of the effect as placebo or nocebo thus depends upon the individual's perceptions of these effects as desirable or not. They maintained that the categorization of the phenomena as placebo or nocebo could be misleading, as the same drug incites the same reactions in all individuals. The subjective interpretation of the effects as either desirable or not leads to the phenomena being inaccurately labeled as mutually exclusive, thus creating a false impression that the drug is causing distinct reactions. Anthropologists Robert Hahn and Arthur Kleinman have broadened the scope of the concepts of placebo and nocebo to distinguish between rituals that are intended to heal and those meant to harm. The understanding of these terms has evolved and is now used to classify rituals, beliefs, and outcomes into two categories: harmful placebo and beneficial placebo. The essence of this distinction lies in the intentions and beliefs of the performer of the rituals. However, exceptions can occur where outcomes are paradoxically opposite to the intended effects, a complexity signified by Hahn and Kleiman. Milton, based on his considerable experience treating over 1,000 melanoma cases at Sydney Hospital, shed light on the profound impact a prognosis can make. He described a subset of patients who, faced with the dire realization of their impending death, suffered premature death quicker than the progression of their illness. The situation is relatable to the lethal outcome of the pointing the bone witchcraft by primitive societies. Multiple researchers express a concern about the ethical dilemma presented by the potential harm that can arise from discussing possible treatment side effects with patients. The ethical duty to respect a patient's autonomy by sharing potential treatment risks may inadvertently lead to additional harm, thereby violating the ethical principle of non-maleficence. Various models of informed consent, such as the framing effect and authorized concealment, have been proposed as ways to minimize nocebo effects and uphold patient autonomy. It is suggested that forcing patients to be informed about all adverse effects against their wish may itself constitute a breach of autonomy.